Thank you, Mr. President. We live in times of great challenges and even greater opportunities. Thanks to technological and scientific advances, people around the world live longer, healthier lives. The global under-5 mortality rate decreased by more than half since 1990, and new research and drugs have significantly improved our ability to fight diseases such as malaria and tuberculosis. The link between health and sustainable development is clear. Promoting global health helps to reduce poverty and inequality. It advances peace and security and lays the foundation for economic growth and prosperity. These issues are at the very core of the 2030 Agenda for Sustainable Development, and achieving them will require the enhanced cooperation of all stakeholders. This year, the international community made remarkable commitments towards sustainable development with the adoption of the 2030 Agenda, the Addis Ababa Action Agenda, and the Sendai Framework for Disaster Risk Reduction. These important roadmaps will help to guide us as we set the course toward a world free of poverty, hunger, and disease. In order to achieve our global goals and provide universal access to quality health care, we must invest in resilient, robust health system, strengthen country and regional capacities, and improve the skills and working condition of the health workforce. Health workers are not only essential for the functioning of health system, they are the very flesh and bone of every society and must be safeguarded. Unfortunately, health workers find themselves in harm's way too often and in too many places around the world. Israel remains concerned by the deliberate targeting of health workers, as well as by the cynical exploitation of healthcare facilities by terrorist groups who seek shelter, store weapons, or even perpetrate attacks from within hospital and medical clinics. This not only compromises the neutrality of the facility and its staff members, but also puts at risk patients and their family members. The international community must strongly condemn such violation of international law and ensure that medical facilities and personnel are protected by all the means at our disposal. Mr. President, global health threats can devastate entire communities and set back years of progress if not dealt with efficiently and rapidly. This year, the world witnessed the widespread devastation caused by the Ebola outbreak in West Africa. While the spread of the disease has been contained, the road to recovery and rehabilitation is long and full of uncertainty. Medical staff and health workers are often among those most affected, placing an additional stress on already overburdened health systems. It is up to all stakeholders to continue their effort to strengthen the resilience of health system and to improve the quality and condition of medical facilities and local health workforces. Just 2 weeks ago, Israel set up a mobile field clinic in Liberia to assist medical professionals treat diseases which require isolation. This is the third such clinic dispatched by Israel over the past year to countries affected by the Ebola virus. Mr. President, health and public health has always been a top priority for the State of Israel. Since its establishment, Israel has focused on developing innovative and effective solutions to meet the range of health challenges facing our population. This year, Israel was ranked by Bloomberg as the 6th healthiest country in the world with one of the most efficient health systems. Israel's universal healthcare system extends quality care to all of its citizens, Jewish and Arab alike. In addition, every year, hundreds of thousands of Palestinian patients from the West Bank and from Gaza receive various medical treatments in Israel hospital, ranging from cancer treatment to surgeries and emergency care. Israel's healthcare is not only a model of efficiency, it is also a model of coexistence. If you step into an Israeli hospital, you will find Christian, Muslim, and Jewish doctors working side by side for one common goal: to save lives, save patients of all religions, of all walks of life. Mr. President, Mashav, Israel's Agency for International Development Cooperation, serves as a bridge between Israel's medical community and the developing world. Its program in the field of emergency, medicine, and public health focuses on capacity building and preparedness of local medical staff, especially in rural areas. In the town of Mepika in Zambia, Israeli medical teams set up an eye camp that trains local medical personnel and screened over 1,000 patients with various eye disease and cataract. Another important area of focus for Israel has been maternal and reproductive health. Women who are healthy and have control over their bodies are able to provide better care for their families and fully contribute to their communities. Last year, Mashav and the Millennium Cities Initiative launched 2 neonatal special care units in the rural city of Kumsei, Ghana, with the aim to reduce neonatal and maternal mortality. Israel's commitment to global health also extends to areas affected by natural disaster. Over the past 2 years, Israel has dispatched humanitarian aid, medical staff, and supplies, including fully equipped field hospitals, to disaster-stricken countries around the world, including Nepal, the Philippines, Serbia, Bosnia, Madagascar, and Haiti. Mr. President, to conclude, Mahatma Gandhi once said, and I quote, "It is health that is the real wealth and not pieces of gold and silver. Let us all work together to ensure that our children enjoy a world that is not only wealthy, but also healthy and harmonious for all." Thank you, Mr. President.